are the only dermatologist I've ever been to. We should start with men's skincare.
What could be the most basic skincare routine for men?
The biggest damage we have on our skin is ultraviolet radiation. So the first thing I always tell everybody, even if you don't want to do anything, just start applying a sunscreen.
What would be the relationship between acne and diet?
If people have a high sugar, that will lead to acne.
Men really worried about hair fall and hair loss. I saw something around, applying onion juice and things like that. What, in your opinion, is the biggest myth?
The first myth is biotin. Throw that biotin. Why onion juice has become so popular? They have a little bit of a DHT suppressant activity.
Would you say that the hair transplant now is safe?
Yes, hair transplants are very safe, but
Okay, Doc, thank you so much for being here with us. And we're going to really pick your brains on everything skin and hair for men, women, kids, everybody.
fantastic. Thanks for inviting me.
You are the only dermatologist I've ever been to. And I think my relationship with you goes all the way to like 18, 20 years, close to 2 decades. And the listeners and viewers must know that, okay, today I have a zip, but you're the reason for my good skin. I remember my 20s were nasty with so much acne, like a lot of women go through, but I think I just found you at like the right time, just before I was getting married. But I think the beauty is it's not just about that, okay, I didn't have acne during my wedding. I think after I saw Dr. Chai and what the treatment she did for me, it's been 20 years and I've had no acne issues. I mean, you've been my go-to. And Dr. Chyta is, of course, the founder of Kosmoderma, which is literally all over the country. Yeah, Doc?
Yeah, 12 clinics now.
Yeah, there you go. Yeah, but I'm not going to go into detailed introduction because I can't stop. You've done so much in this line of work. And, I think your talk can say everything over the next,
Thank you. That's
minutes.
so sweet.
But thank you so much. Yeah, your knowledge should be out there and people should, I think, know more about skin and hair. And there's no better person than you to talk about it.
Thank
you. Yeah. Let's talk. Okay, we should start with men's skincare because I feel like it's literally not spoken about.
Because in general, talking with personal experience, we feel that we don't really need skincare. At least I have grown up with that thought process. And even right now, I just go out on the beach or wherever, not even wear a sunscreen. My wife keeps telling me to put on a sunscreen, and I wanted to ask you if that's even needed.
No, I'll see you in your 50s with a lot of pigmentation. We'll talk then.
Don't say that you don't use sunscreen. She'll be very upset.
No, I'm not, because he's going to be a patient for me when he's 50 and he's going to have all that hyperpigmentation. And then in his 50s, he'll look older than his wife, and so it'll be good.
Yeah, because your wife goes to Cosmoderma.
Yeah, she does. She was going to book an appointment for me very soon.
Now you have to.
Yeah, now I have to. So I'm not against sunscreen, by the way. It's just one, bias that I've had, as in, I don't really need it. But before we get to that, I just wanted to understand, in personal interest, what could be the most basic daily skincare routine for men?
It's actually very simple. And what do you feel, that bias that you have? Most men have that bias, right? And that's because you guys have testosterone, which actually produces enough oil in your skin to keep it nourished. And I think that's why you get away with all of this. But in today's world, there's a lot of pollution and, there's environmental damage. And then the biggest damage we have on our skin, man or a woman, is ultraviolet radiation. So the first thing I always tell everybody, even if you don't want to do anything, just start into the routine of applying a sunscreen on a daily basis. It should be like brushing your teeth, right? You're never going to step out of your house without brushing your teeth in the morning. So make it a habit that your sunscreen sits next to that so that you put your sunscreen on. Or if you're having your bath right after your shower, put that sunscreen on. Typically, we would like you to apply it 2 to 3 times a day, but that can be tough and hard. So even if you apply it once a day, I think that's a big win for us, as opposed to a 0 application. So that's the first most, right? A sunscreen application. Now, let's say that you want to do a little bit more. There's 2 other things you can do. Use a soap-free cleanser. Instead of using your soap or your shampoo to wash your face and cleanse your skin, use a soap-free or a pH balanced cleanser, because you don't want to strip your skin of the oil, which is keeping you healthy. And the third thing is, I put in a moisturizer. And it's not about oil or, oats and this and shea butter, etc. It's really about restoring ceramides. which is what is a building block of your skin. So a ceramide moisturizer. So just 3 things. That's all you need to do. It's as simple as that.
It's time that men stop using soap. One soap for body and for hair. Because so many still do that.
Exactly.
Yeah.
And if you ask them, how do you wash your face? Oh, I just take soap and I rub my skin like this. And I'm like, wow, good for you. I'll see you in a few years.
Yeah. Yeah. I have to make my own husband listen to this. It's taken me so much time to convince him that you can't. I know you don't have much hair on your head, or probably none, but you can't use the same soap for your body and your face and your head.
Do you see a lot of patients, though, men in your clinic?
Yeah, I think about 30 to 35% of our patient population are actually men, and we see a huge demographic shift now that's happening. So that whole thing of like, oh, I'm a guy, I don't really need skincare is actually changing. It's also a generational shift. So we are seeing younger men in their 20s and 30s coming in, and we're also seeing men in their late 50s and 60s who never used anything in their life coming in now because they want to look good, because they never did anything because they thought, why do I need to do anything? I have good skin, I'll look good. But now they're like, pigmentation is a big concern. Hair loss is a big concern for the older set. For the younger set, they actually want to proactively take care of themselves.
What about hair loss? So I'd give you another personal example. 10 years ago, I used to travel a lot for work, and I was in Finland. And one morning, I just woke up and I saw a lot of hair on the pillow. And I was like, in my mind, I'm just going to end up losing all my hair, which didn't happen, fortunately, yet. But in general, men, they're really worried about hair fall and hair loss, and it just ends up happening with a lot of them. My question is, first, we end up falling for a lot of myths. I saw something around, applying onion juice and things like that. What, in your opinion, is the biggest myth out there that needs to be busted?
First thing about hair, though, I think it's like a social stigma in some ways. Men are okay that they don't care about lines, wrinkles, pores. They're okay with acne scars, but they don't like that receding hairline. I think there's a fine emotional connect in our brain to our hair and how we feel also, right? With hair, it's all about maintenance. Now, a lot of our hair, the progress is genetically determined. So if there's one parent that has a balding in the family, there's already a genetic sequencing that you're going to go down that line. If both your parents have it, then definitely you're going down that. But that doesn't mean that you can't stop it or delay it. You can. And hair comes down to what is happening to it. In men, a lot of it has to do with the way your body will process your hormone. It's called DHT. All right. And it's an uptake that happens in your hair follicles in your scalp. So, we say hair everywhere except on the head, like how Whey was saying earlier.
I'll come to it once you finish about this.
You have a thick, luscious mustache, beard, full body hair, but this is just bald. It's because only your head or the scalp has that DHT uptake.
Dihydrotestosterone.
Exactly.
And that's something that also got linked to creatine usage at some point.
Exactly. So what happens is that it actually shrinks the blood vessels, all right? And hair is just like a plant or a tree, right? If you put something, you need to nourish it, and you need to put enough water and manure, right, for a plant to grow. It's the same thing with your hair. For your hair to grow, you need the supplements, right? Or nutrition, actually, which is your iron, your vitamin D, vitamin B complex, and proteins, and some trace minerals like zinc and stuff. These are critical, not this biotin. So your first myth is biotin. So throw that biotin supplements out of the door, because alone it's not doing anything. It's just going to piggyback on the rest of this nutrition. And then it's what's happening on the local, the DHT right there. So you need a suppressor there. So you're going to apply a solution that suppresses the uptake of DHT. So minoxidil, as doctors, we always prescribe minoxidil, because when you apply minoxidil on a daily basis, it stops the action of the DHT at the hair follicle. So the hair follicle is still blooming and getting its blood supply, and it's not shrinking in size. All right. So it's your nutrition, and it's something to take away the action of DHT. These two are most critical. Why onion juice has become so popular? Onions, if you break it down, they do have some phytonutrients in them, and they have a little bit of a DHT suppressant activity. So if people wanted to make onion juice or onion juice shampoo and conditioners and everything, but let's break it down. How long is your shampoo on your head? A minute? Conditioner maybe 2 minutes? Not sufficient time for any absorption to happen. It has to be an overnight application. So minoxidil overnight is what helps, right? And you need to take it as a prescription actually, because there are other effects to taking all of this. But there are also some other peptide serums that you can take. So they're not minoxidil, but there are peptides, which when you can apply like Precap and Gain, etc., which also have similar DHT activity. But in the terms of efficacy, if minoxidil is up here, the peptides would be down here. Where will your onion juice be? Here, even if a baseline's down here. So this is the hierarchy of how it works. So this is what one needs to do. And I always tell patients, if you're losing hair, just go consult your doctor today, because we will do a blood workup, understand what is wrong, because it's not just the outside, right? It's inner health, and then it's the outer effect. And if you're suddenly having a lot of hair fall, that is mainly nutritional. All right, you may have had dengue, chikungunya, malaria, typhoid, some flu, or so for men it's typically this that will lead to that drastic hair fall. But if you're having thinning of your hair, that's hormonal. So there's a differentiation. So just putting onion juice or putting like garlic and all of that on top of your head, etc., or even rosemary oil, which a lot of people talk about, is not the fix. Find out the cause, fix it.
Exactly.
Yeah,
And
get help.
these things, should someone do it proactively?
Yeah. Yes.
Or like wait for hair thinning to happen and then maybe...
Then you'll become like my Vivek. Because I think 10 years back, nobody told him that go seek help. And even if they did, he probably wouldn't have.
Yeah.
And now it's too late to seek help.
Yeah. So the thing is, you have to nip it in the bud, right? So any kind of thinning of your hair or intense hair fall is a sign. A lot of times I tell patients that before anything happens, we can see it on your skin and hair. Like your hair shedding, right? Shows that nutritionally you're insufficient. So we can always tell you, so we'll do a blood work, because we're medical doctors. We want to know what your baseline is. I don't want to over supplement you. So I'll do your baseline, optimize your nutrition, your hair fall will stop. Your hair thinning, we'll investigate if something is off. If it's not, then we'll put you on the medication to stop that. There are prescriptive medications like finasteride, dutasteride, etc., which we will investigate men for before putting them on it. But one thing I have to say, that if you start anything, remember that for nutrition, it's a quick fix. You fix the nutrition, the hair fall stops. But when there's hair thinning, it's lifelong. So you're going to have to lifelong take the medication to stop that and to retain that hairline. You do it, you feel good, you stop, the thinning again starts. It's like a flood, right? There's a flood coming, like a river flowing and a flood. You put a dam to stop that flood. So your medications are your dam, but you open that, the flood will continue. So you have to think of that.
So you're saying it is possible to prevent?
Yes, it's
hair
probable
thinning.
to prevent it from going further. It's probable to reverse it too. So let's say you already have hair thinning, then just medications will not help. Medications will help stop it from getting worse, but you can have procedures like growth factor concentrates, PRP, you can have stem cells now, and then you can have exosomes. So multiple different treatments to regrow the hair in a skin clinic or a hair clinic. But you can definitely stop it from further progressing with medications.
And would you say that the hair transplants that everyone's doing now is safe?
Yes, hair transplants are very safe, but you have to make sure that you're having it in a certified clinic with a certified doctor. A lot of times you'll see technicians doing it. You'll see it happening in salons. Salon is not a place where you want to have a transplant, because it's a surgery, right? You're literally making, like, we're going to take it out from the back of your scalp, put it on the top of your scalp. So it is mini surgery, right? I mean, it's a day surgery, but there is anesthesia. There's anesthesia risks involved. So there are hair transplant centers that are certified hair transplant centers. So please go there. This is not something where you go bargain hunting, because your life can be at risk from anesthesia risk.
I have a question for, okay, Vivek doesn't have hair, but like you said, people don't have hair on the head, but he has a beard. Now, nobody talks about beard care, right? And there's like burns and irritation from shaving and all of those. Any tips for beard care for men?
Yeah, and today the most Indian men love those big, heavy beards.
Yeah.
Yeah. So the care of the beard is very similar to the care of your scalp, right?
Ah.
When you're shampooing it, you still need to wash it. And when you're washing your beard, I always tell people that if you have a thicker beard, put your hand under and do the skin, cleanse the skin. It's not just the beard, because beard is
Not the
hair.
hair,
Hair
yeah.
is dead.
Yeah.
It's from where it comes in. So you can be prone to dandruff, you can be prone to fungal infection.
Yes.
And a lot of men do get like they think it's acne, but it's actually folliculitis. It's bacterial infection in that area from the sweating and heat boils, etc. So you do need to cleanse your beard every time you shower. So that's important. And if you have frizzy hair on your head, when you condition that, you need to condition your beard also. So this is important care to do. And if you shave, like a lot of men, especially here in this cheek area, if they shave, or people who are clean shaven, they tend to break out in this area.
Yes.
It's perifollicular acne, or it's folliculitis, or it's something like pseudofollicular barbe. Those are the different medical terms. But basically, it's infection from bacteria, typically in your hair area, because when you shave, right, your skin gets nicked, all right? And all of us have bacteria in our skin. But if your immunity is low, that'll cause that infection to flare up. So you want to make sure that you're taking care of those areas, keeping it clean. And if you start seeing dandruff, it's the same anti-dandruff treatment that you would do for your scalp. You'll do it on your beard also. You'll have to invest into an anti-dandruff shampoo, something with ketoconazole, etc. And use that, leave it on for 5 minutes, wash it off once a week so that you get the dandruff down. That's important to care for it.
And how about someone who doesn't get a lot of growth of facial hair?
Yeah.
Is that something that's like, maybe someone wants to grow their beard, but they're just not able to do it because it's not happening?
Yeah, so that's again a genetic problem, and it's also linked to the hormones. A lot of times that low testosterone can lead to that, or people who've done anabolic steroids, right, to muscle build and to do body lifting, you see a lot of that in them and stuff. So in that case, it is a medical issue. We will have to investigate, but we can regrow beard in areas that they're not getting enough growth. It's possible.
Another problem that men generally face is a lot of acne is on the back.
Yeah.
Acne.
Oh, that's what it's called.
It's called acne now.
So what about that? Why does that happen? How can they prevent?
You know, it's a great question. Men are way more prone to back acne than women are. A lot of times they may not even have acne on their face, but they'll have it on their back because you have hair, right? Wherever you have hair, you have oil glands coming out. And like I said, testosterone, more oil. And when there is more oil, we all have this bacteria. It's called C. acnes. It sits on all of us. It's just that when the condition is more fertile, it'll flare up. So low immunity, poor habits, increased stress, all of these are triggers. And so that's why men get more back acne. And also men tend to sweat a lot more than women, and they're using their shirts, and they don't think about cleansing in the same way. So I would always tell them that they can use a salicylic acid or a glycolic acid based body wash, like once in every 2 to 3 days if they're prone to it. If they already have acne, then to use it on a daily basis. It helps soften the skin in that area, even though it's just for a minute of application or 2 minutes of application, and that helps. But if you're getting back acne, a lot of times you will need antibiotics to clear up the infection. And a lot of men will say, it'll go away on its own, it'll go away on its own. And then it'll go away on its own, but it'll leave these marks and scars. And then today, beach body not happening when you get to the beach, right? It's like, you'll be like, hi, Spotty.
But so now, like you said, men anyway sweat a little more and all of that. So what about like then exercising? Because during exercise, you're just going to sweat profusely. And I've seen how some men just sweat so much more. Like, yeah, you literally have to have a bucket there.
Yeah.
Like if they're not carrying a hand towel, it's scary.
It is,
You know?
right?
So in that case, you need like so much more.
So the thing is, when you sweat a lot, right, and then you do your cool off, go and have that shower after you cool off.
Immediately.
Yeah, like cool down and then go start with a very tepid or a lukewarm water and wash it off. And then just cleanse yourself. That's it. That's important. If a lot of people don't think about it, right? They'll say, I'll go home, and then they'll go home, then they'll stop somewhere on the way. By the time they have a shower, it's 2 hours later, 3 hours later. By then that sweat dries, and sweat is salt, right? And salt is irritating to the skin. And that again will lead to this whole loop, right? And so you'll break out and stuff. And more than that, they're like stinky. Forget spotty, they're stinky. But so I always tell them that please try and shower in your gym. If you're one of those people who sweat a lot, just shower there, or within 60 minutes after your cool down, try and shower so you wash it off, and use a pH balanced cleanser or a soap when you're using that, something that's gentle. And do not use a loofah, do not use a scrub after your exercise, because once you've exercised, remember, because of your exercise, blood rushes in, right? Your peripheral circulation improves, so you're like red, flushed, hot. Last thing you want to do is that sensitized skin which is already flushed with blood, sit and scrub it. That's irritation, and that will further traumatize the skin.
Oh, wow.
So much to keep in mind.
Yeah. And
not so much.
But is there something called exercise-induced acne?
Yes, there is. This is from the friction, right? Because like, remember, rubbing is heat, and that's again friction. So if someone's already prone to acne, and then they're doing the exercise and they're using these fibers which are not good, like clothing fibers, and that's like rough, that constant friction, like think you're doing this, your fabric's moving, and that causes constant friction, then it'll cause frictional acne. And then even like when they wear bicycling shorts and stuff, and then a lot of men have hair, right? And that hair also pulls, so it causes that traction. So again, that causes. So a lot of them actually get laser hair reduction done now because it's much more convenient.
Makes sense.
Yeah.
Especially the ones who want to like do these activities and work out, and it's a big part of their life.
Yeah. They're like in general, people are scared with respect to laser hair reduction causing cancer and things like that. Is that true?
It's a big myth, but it is. People will say, oh, laser, it'll cause cancer. But what I want to say is that these lasers, which are for laser hair reduction, they are in the infrared, near infrared region of light. The cancer-causing lights are on this spectrum, which is ultraviolet rays on the bottom side. There's a whole spectrum of light. So you have ultraviolet, then you have visible light, which we see, and then you have the infrared. So laser hair reduction sits here. So there's nothing cancer causing about that. Only thing I advise is that make sure that you look into a machine that's US FDA approved. There are a lot of fake laser machines available now. And laser hair reduction is also a medical procedure, not to be done in a salon or a spa, has to be done in a clinic, because what people don't realize is this, what we call as a grade 4 laser. If by mistake they shoot it into your eye, you can go blind. And that's how you have to be cautious about it. So it has to be under medical supervision.
Yeah, I think that's important information. Because like salons, left, right, and center.
And they get these Chinese lasers and they're like, oh, you're doing laser hair reduction and you see burns. That's what we see. We see a lot of burns and we see a lot of reactive hair growth, which means instead of destroying the hair, they actually got more hair.
Yeah. And in fact, they're like now, in fact, salons is one thing, but you can now book a laser, they'll come home and...
Correct. Yeah. There's home laser devices. The thing is, you need to consult with a doctor.
Exactly.
Not just have it, because every time your hair changes, the setting of the laser changes to the skin and your hair. And if it doesn't change, then you're not going to get the results. And that's why a lot of people will say, oh, I had 8 sessions, 20 sessions, nothing happened. And I'm like, I can't comment because I don't know what kind of laser you had.
Yeah. And since we were talking about acne and exercise-induced acne and things, what would be the relationship between acne and diet or supplementation?
It's a great question. The reason is diet. Now, a lot of studies have shown that if people have a high sugar or a simple carbohydrate diet, right? Something that gives you sugar very fast, spikes, that will lead to acne, right? It's not cause, but it'll trigger in somebody who's already predisposed to acne. The other one is whey protein. I know you both are from the fitness world and we talk about protein supplementation, but whey. Why? Because lactose intolerance is also a trigger for people for acne, right? So whey, again, is a milk origin. A lot of milk goes into creating whey protein. So whey is actually triggering acne for people who are sensitive to acne. So what we tell them is don't take whey protein. In that case, take glutamine, which is the amino acid itself. So that's safe, but not whey protein. And also over supplementation, right? Like right now, it's such a in thing to see these reels and YouTube shorts and then start supplementing yourself. But what I want to tell is that supplements are required for women, for especially for Indians, because by nature, Indians, we don't create enough vitamin D. It's not because we don't have enough sun exposure or because we're dark, and it's not. Genetically, the enzyme that's required to help us make vitamin D is on the lower side for Indian origin people. So we must vitamin D supplement, but not on a daily basis. Like once a month, you need to take it, right? A high dose once a month, not every day. Similarly, vitamin B12, because that is animal origin, right? Vegetarians will have vitamin B12 deficiency. So you need to take vitamin B12 deficiency. Iron, Indians don't absorb iron because of our gut in the same way. So you will have to iron supplement. These are the 3 critical supplements that everybody has to monitor. So once a year, if you have a blood test, you'll know your week or thing. It's not about being in the normal range, but it's being on the optimal range, which is towards the higher side of normal. And that's where you have to be, on optimum health. So that's where supplementation comes in. But the whole other fanciness that's come in, like trying to do melatonin, trying to do magnesium, and trying to do cysteine just on their own, etc., or carnitine on their own, I think that's overrated. You need to do it when your body needs it. If you're in your 30s, your body should be able to produce on its own for a lot of these things. You're in your 40s, 50s, sure, you're depleting, so you're going to optimize. But 20-year-old supplementing absolutely is a bad habit.
Okay, shifting gears a little bit. Why do women do so much skincare?
I don't.